Buenos días a
Good
todas
morning,
y todos.
everyone.
Les damos la
We would
bienvenida
like to welcome
a este
you
webinar
to this
del Banco
webinar
Interamericano de
hosted by
Desarrollo
the Inter-American
y
Development
del
Bank and IDB
La
Lab.
conversación será en español.
The discussion will be in
If you
Spanish.
wish to listen in English, you can select English in the interpretation button in your Zoom. Se quiser ouvir em português, pode selecionar português no botão de interpretação no seu Zoom. Soy Marcos Tampini, especialista de la División de Protección Social y Mercados Laborales del BID.
I am
Y voy a
Marco
moderar
Santini
este webinar.
from the labor
Para
markets
comenzar,
and from the
tendremos
IDB,
unas
and we would
palabras de
like to
bienvenida
begin with a
de
few
Irene Arias,
words of
CEO de
welcome
BID.
from Irene Arias at IDB Lab.
Buenos días a todas y todos.
Good
Soy
morning,
Irene Arias,
everyone.
CEO de BitLab.
I am
Es un
Irene
placer estar con
Arias
todos
from
vosotros
IDB
en
Lab,
este
and it's a
espacio
pleasure to
tan
be with
necesario y
you
oportuno, porque
during this
vamos a hablar del
very
emprendimiento
timely forum.
en el
We're going
segmento
to be
de cuidados
discussing
de las personas
business
mayores.
ventures in the
Quiero
area
agradecer a
of,
los organizadores
elder
por esta
care.
invitación,
I'd
a
like to thank
cada
the
uno de
organizers
vosotros por
for
el
inviting
compromiso con
me
esta
and like
causa.
to
Una
welcome all
causa
of you
que
for
desde
making this
BitLab, como
commitment,
brazo de innovación y
because
venture capital
that
del BID,
IDB
y junto
Lab,
al BID
working
y
with the
BID Invest,
IDB
estamos
and IDB
promoviendo.
Invest, we
Es
are
la
promoting
economía
together.
plateada.
This is the silver
Y la vemos
economy,
con tres
and we
ámbitos. El
really
primero,
view
el
this
de
from the
empleo y
perspective of
emprendimiento de
three
las personas
levels. First of
mayores.
all,
El
employment
segundo, el
and
ámbito de las
business ventures
finanzas.
with
Y
elderly
el
people,
tercero,
also
el
from the
ámbito del
financial
cuidado, que es el tema de
perspective
hoy.
and from
Creemos
the
firmemente
long-term
que el
care
cuidado
perspective. We
no es solo
firmly
un reto
believe
social,
that care
es una oportunidad de
is
crecimiento
an
económico para América
opportunity
Latina y
for
el Caribe.
economic growth for Latin
Os voy a
America
dar un
and the
dato que es
Caribbean.
impresionante,
I'm
y
going
es
to
que se
share with
invierten
you some
más de
interesting
16.000 millones de
statistics. More
horas al
than
año
$16
en
billion
trabajo de
a
cuidado
year
no
are
remunerado.
invested
Esto equivale a
in
2.000 millones de
unpaid, well,
personas
equivalent to unpaid care,
trabajando a
which
tiempo
is 2 million
completo
people
sin
working
salario.
full-time without any
Por tanto, el
pay
reto
or
es enorme,
compensation.
pero hay
So
también
it's
un
a
gran potencial de convertirlo
daunting
en una oportunidad.
challenge, but there's also an
¿Cómo?
enormous
Bueno, por el lado
opportunity.
de la
On the
demanda
one
de
hand, from
soluciones
the
innovadoras,
demand
vemos
for
que el
innovative
sector de
solutions,
cuidado de
we
largo
see that
plazo
the
es
long-term
un
care
mercado cada vez más
sector
grande.
is an
Y
increasingly
vemos que
larger and
hay
larger
soluciones que
market,
están
and
emergiendo,
we
pero que
see
se necesita
solutions that are
construir un
emerging, but
ecosistema de
they
innovación
require the
alrededor
developing
que
an
las
ecosystem
impulse
of
y que
innovation
ayude a
that
que se
will help
conviertan
to
en modelos
encourage
de negocio
launch these
sostenibles.
into
En
sustainable
este camino
business
hemos
ventures
visto
and models.
emprendedores
We
increíbles,
have
van a
seen
conocer algunos,
incredible
y
entrepreneurs. We're going to become
que la
familiar with some
innovación
of
en el
them.
sector de cuidado
Innovation in
puede ser
the
efectiva,
care
pero solo si
sector
la
can be
trabajamos de forma
productive, but only
colaborativa y
if we work
multisectorial.
in
Y por
cooperation
eso
at
es
the
tan valioso el trabajo
multisectorial
conjunto
level.
que
That's
desde
why
BitLab
joint
estamos haciendo con el
efforts
sector
are
social
so
del BID.
valuable that the
Y
IDB is
vamos a ver
the IDB
ejemplos como el
Lab
de
and the social
AnaCare,
sector
un emprendimiento
division of the IDB
cuyo
are
CEO
focused
Ariel
on. We're looking
os
at
va a
AnaCare, which is
contar
something
que
that
desde
Ariel
México
will
está
discuss,
atendiendo
and this
uno
is
de los
in
aspectos del cuidado de
Mexico
personas mayores.
that is
También
addressing one
con
of the
Fundación
aspects
Arturo y
of
Sesana
long-term care
promovemos lo
of
que
older
llamamos la
adults. And we're also
región plateada,
promoting
que es una iniciativa
that
regional
this
para fomentar la innovación en
silver
el cuidado en
region,
toda la
which is an
región. Y
innovation that is fostering
recientemente
care throughout the
acompañamos
whole region.
la
And
publicación del
recently,
BID
we supported
Plan
the
para la
publication
construcción
of
de
the
un ecosistema
plan,
emprendedor
IDB
para los
plan
cuidados de
for
largo plazo
a,
en América Latina y
entrepreneurial,
Caribe.
program, long-term
Pude
program
escribir la carta de
in
apertura
Latin
y
America. In
este
fact, I was
documento
able to
ofrece
prepare the
una
opening
hoja de ruta
words,
para
and this
fortalecer
really
el ecosistema
provides
emprendedor
a
en este sector
roadmap for
clave.
reinforcing
En línea con este
entrepreneurship
compromiso,
among the
también
elderly in
el
this
BID acaba de
key area.
presentar
IDB has
BID
also
Cuida,
just presented
que se lanzó
IDB
recientemente en la
Care,
Asamblea de
which was
Gobernadores en
launched
Chile,
recently at
liderada
the
por
meeting
Diana
of the
Rodríguez.
the Board
Y
of Governors in the
hoy,
IDB
más que
in
nunca,
Chile.
queremos
And today, more than
doblegar
ever,
nuestros
we
esfuerzos
hope
para
to
encontrar esas
redouble our
soluciones
efforts
innovadoras
so that we
que
can find these
respondan a
new
los
innovative
desafíos del
solutions that
cuidado
effectively
y que
respond to
aprovechen el
care
potencial que esto
needs
tiene como
and that
motor de
maximize the
desarrollo económico y
potential
social.
of these engines
Estoy
of
segura de que esta sesión va a ser
socioeconomic
un gran
development.
espacio de
I think
aprendizaje,
this
de
session
colaboración
is
y
going
de
to be a
generación de
wonderful
nuevas
forum
ideas. Así que
for
muchas
strengthening
gracias y que
cooperation
sea
and
una sesión muy fructífera.
creating new ideas. I thank you very much for attending, and I wish you a very productive meeting.
Quiero agradecer a
Well, I'd like to
Irene por su
Irene
participación
Irene
y a
for
IDLab por el trabajo
participating
que hemos venido
in this
haciendo desde
initiative, as well as
más de
IDB
5
Lab for all their
años
work,
en el área de los
where
cuidados
they
de
have been
largo plazo.
devoting efforts over
Y
the
este
last
trabajo
5
se
years
debe al
in
hecho que
long-term
IDLab ha
care
elegido los
for
cuidados
the
de largo
elderly.
plazo
And
como una de las áreas
we are
prioritarias
looking
de
at one
su
of the key
agenda de economía
priority
plateada.
areas with regards to
Quiero
the
darle un
silver
ejemplo de
economy.
este
Just to give you an
trabajo que hemos
example
venido
of the
haciendo.
efforts that
Y
we
es
have
el
been
proyecto de
undertaking, and this
IDLab
is
que se llama
a
Región Plateada.
IDB
Este proyecto está
project,
implementado
IDB
por la
lab
Fundación
project
Cesana
called
de
the
Colombia en
Silver
colaboración con el Grupo
Region,
Empatia
and this
y tiene
includes
como
Colombia
objetivo
working
ayudar
as
la construcción
with
de
the
un
various
ecosistema
stakeholders that are looking
empresarial
at
en el
developing
área de los
an
cuidados de largo plazo,
entrepreneurial
mejorando la calidad de los
initiative that
servicios y
strengthens
la
the quality of
formación para las
services
personas
and
cuidadoras.
training
Este
caregivers.
proyecto une el
The
conocimiento
project
técnico de
brings
la parte
together
pública
technical
del Grupo BIM
know-how from
y
the
también la
IDB
capacidad
group
de
and
captar,
also
de trabajar con
IDB Lab's capacity
innovaciones
to work
y
with
apoyar el
new
desarrollo de
innovations and
ecosistemas de
support the
emprendimiento.
development of
En la primera
entrepreneurial
parte de la
new
convocatoria, el
systems. As
proyecto
a part
recibió
of this call,
234 propuestas
where 4
concretas,
proposals
de las cuales
were
se
brought
seleccionaron
forth, of
35
which
para la aceleración,
there
y algunas de
35
las
were
cuales recibirán
identified
financiamiento
that
para
will
su
receive
escalamiento.
funding to scale up
Región
these
Plateada hará
initiatives.
una nueva
So
convocatoria
the
que empezará el
Silver
30 de junio de
Silver Region
2025.
will begin in July
Entonces,
2025 to call for
invitamos
new proposals, and
a
we
hacer
invite
atención a esta
that
convocatoria
you
porque realmente es una
follow
excelente
up on this
oportunidad.
call for proposal, because it's going to be an excellent
En
opportunity
este webinar
that
vamos
we
a
need to
conversar
maximize.
sobre
In
dos
this webinar, we're
experiencias
going
de
to discuss
emprendimientos en el área
two
de los cuidados de largo
experiences
plazo
in terms of
en América
long-term
Latina y el
care
Caribe.
in Latin America and the
Estas
Caribbean.
experiencias
These
muestran
experiences
que los
will
cuidados
show that
generan
care
oportunidades de
provides
emprendimiento
new
y también
opportunities for
empleos,
entrepreneurship as well
y
as
al mismo tiempo
jobs.
mejoran la
At the
calidad de
same
vida
time,
de
it
las
improves
personas
the quality
mayores
of
de la
life
región,
of the
sus
elderly people
familias
in the
y
region,
las
whose
personas
families,
cuidadoras.
as well as
Pero
caregivers.
además, estas
In addition
soluciones
to that,
innovadoras del sector
these
privado tienen el
innovative
potencial de
solutions from the private
convertirse
sector
en
have the
instrumentos
potential
para
to
mejorar
become
los
tools for
servicios financiados
improving
por el sector público,
services
con una
funded by
buena
the public
sinergia entre el sector
sector.
privado y el sector público.
To create these
Por
synergies
esta razón,
between
estamos
public and private
convencidos que el
sectors
webinar de hoy
partners.
es relevante
Today's
para una
webinar
amplia
will be,
audiencia
I think,
que incluye
relevant for a
emprendedores,
broader
trabajadores
audience
del
that
sector,
includes
pero también
entrepreneurs
gobiernos
and
y
workers in the
finalmente
sector,
personas
as well as
mayores y
government
sus familias.
stakeholders and members of the
Tengo el honor de
elder
presentar
community.
a
It's a
nuestro panel de
pleasure
lujo.
to introduce
Contamos con
our
Ivan Spolansky, que es
outstanding
cofundador
panel. We
y
have
director
Ivan
ejecutivo de
Spolansky,
Cuidados en Argentina.
Executive Director
Es
of
también uno
Cuidados
de
of
los
Argentina,
proyectos
this is one of the
seleccionados en la
projects
primera
selected during the first
convocatoria del proyecto
round
Región
of
Plateada.
proposals.
Y también contamos con Ariel
We also
Silberstein, que
have
es cofundador
Ariel
de Anacare de
Silberstein, who is
México,
the
que es uno
co-founder
de
of
los
Anacare in
de los
Mexico,
proyectos seleccionados
that
en
is
la
among the
convocatoria de
projects that
economía
we
plateada
selected
del
in the call for
IMLab de
proposals
2021.
of the IDB
Sean los
Lab
dos
initiative
muy
in
bienvenidos.
2021. Welcome to both
Como
of you.
saben de la portada del
As
evento,
you are aware,
esperábamos contar
we
también
were
con la
hoping to
presencia de
also
Mar Entrambaguas Garrido,
have
directora
Ms.
de Desarrollo
Guerrido,
Estratégico de
Director of
Teleasistencia de
Strategic
Tuxpan,
Development
España.
in Spain.
Desafortunadamente,
Unfortunately,
Mar tuvo que cancelar su
Mar had to
participación debido a
cancel
los problemas generados por el
because
apagón
of
general
some of
en
the issues
España
that came
ayer,
about as
y
a result
claramente ha afectado
of
de
the
manera importante
power
a
outage
los
in
servicios de
Spain
teleasistencia que
yesterday.
se están reactivando hoy.
But they are now reactivating the
Entonces, más
tele
tarde le contaré algo
communications
sobre el tema de la teleasistencia,
resources. We'll talk a
pero
little bit about
no podemos contar con la
telecare
presencia de Mar hoy.
later on, but we're not going to be
Quisiera
able to have our third
comenzar
speaker with us. So let's
contigo, Iván,
begin with
y
Ivan.
pedirte cómo
And I wanted to
llegaste
ask
al
you,
sector de
how
los cuidados
did
de largo
you
plazo.
How did you get into the long-term care sector? Well, good morning, Marco. I'd like to thank all of the representatives from the IDB Lab, the other panelists. First of all, thank you for giving me the opportunity to share this experience. I have always had a calling to work in these entrepreneurial ventures. And then I finally became very much attracted to the caregiving sector. And this came about a few years back in 2009 when I was director of the Hirsch Center, one of the most prestigious elder care programs. And in fact, in April, they're celebrating 92 years. We launched a course for 52 informal caregivers, and we know that the region is known as the precariousness and lack of knowledge and skills in this area. This was a major contribution. Participants then would attend 8 courses, 3 hours each on Wednesdays with specialists, and I was able to see firsthand the transformation that this group underwent and how this was empowering them, not just by providing them know-how and skills, but also giving them greater self-confidence. So we asked ourselves, what can we do in order to take those caregivers in these prestigious institutions but have very little access? How can we expand that to more households and to more people? And one thing that we learned that was sure, we looked at how we would be able to provide care for all of us during a part of our lives, to help all of those in such a very special time. And we know that essential. So we created a group of specialists in digital communications, in IT, and in 2020, we launched our caregiving project. Ivan, you talked about caregivers, the workers in the caregiving sector. They are a fundamental component of the silver economy. We have millions of entrepreneurs, millions of workers who work in homes, in various institutions, and we know, according to a recent publication from the IDB, that these are people who are overloaded with work and they're poorly paid in many cases. Could you just discuss what does Cuidarnos do in order to improve this situation? Go ahead. Well, first of all, let me just give a broad overview of what Cuidados is. And we're going to look at the digital and physical care that provides remote support for families, caregivers, individuals, with an aim of transforming home caregiving in a more professional and well-organized process. We do this basically through multi-platform approach with all of the devices necessary, iPads, computers, etc. And to promote this, we provide training and certification for caregivers with a social health profile, which is a major shortcoming throughout Latin America. We've seen a great deal of development in the in-person medical support, but we've now developed courses supported by the competent authorities in Argentina, as well as signing agreements, training agreements with the most prestigious organizations like the Hirsch Foundation and the NECO. That's on the one hand. In order to promote employment and structure it properly, the platform allows that those caregivers who are interested can register their background, the information, their skills, their courses, background training, all the information available in their profile, so that they can provide services to the community. And this way, families can then assess the profiles of these caregivers and then get in touch with them without any intermediaries. Caregivers can then expand access to more opportunities, not just in their own communities and neighborhoods, but in other areas and through other organizations that can help them expand their job opportunities. And in addition to that, we follow up the families and caregivers with tools in order to improve the quality of home caregiving. We provide systems of management and follow-up. This is known as the digital caregiver notebook or playbook. We also create various protocols that make up the best practices in this area. Today, we are fully developing a marketplace that allows providers to offer their products, caregiving products, so that the families, individuals, caregivers can then access to these resources in a timely and secure fashion. We have also included tools aimed at promoting active lifestyles in the homes in order to provide skills so that families and caregivers can work together. We develop a very interesting array of activities generated by specialists in these fields, in physical, recreational, cognitive skills improvements in the home life. Recently, just to give you the broad expansion of the integrated proposal, we have developed an online follow-up service that helps guide and follow up activities for the elderly. The processes include psychosocial interviews, a personally adapted or tailored online program for each one with specialists. All of this and much more is available in this multi-platform 24/7, 360 days a year. Thank you very much, Ivan. I'd like to just pick up on some of the points that you raised in your presentation. In 2019, I remember at the IDB, we developed the policies. In fact, there was an event where we had comments by Richard Cook from the UK, who was presenting his initiative on social entrepreneurship. It was called long-term care at the IDB. And in the this venture was launched because the person involved had her mother suffering from the effects of dementia at a very early age, at 55, and she realized that there wasn't information about the skills and background of caregivers, that families have a huge gap of information as to who are these caregivers and what about quality caregiving that they needed information about. So this venture, at the time, there was nothing like this in Latin America and the Caribbean. And now we're looking at solutions that attempt to resolve these challenges. One other point that I wanted to highlight is that when we conducted the study on the development of an entrepreneur ecosystem, most of the entrepreneurs in this sector, they get there because of some personal event in their lives or just something that in their lives that give them a better understanding about the importance of this sector. And this now helps me segue to Ariel. How did you get into this sector, Ariel? Well, first of all, thank you for kindly inviting me to attend. I'm going to get right to the answer so that we don't waste any more time. Several things happened to me. I had been involved in social ventures for more than a decade, and suddenly I had an opportunity to participate in two things. The first event was I went to the university, and I remember we talked about the future and how technology could address most of the challenges that we face, and that this would help to solve issues that we face in life. In fact, perhaps ultimately leading to immortality. People will live more than 100 or even 150 years. But at the same time, I was faced with a problem in my family. I had a great uncle and great aunt who were suffering from the
veía
effects
a mi
of
mamá
dementia. I saw my
lidiando con
mother
este tema del
dealing
cuidado
with this problem as far
de
as
forma a
caregiving,
distancia.
and this was a long
Y
distance
sentía
caregiving
la angustia,
challenge. And I
lo
felt
difícil
the
que es
difficulties,
no
the
estar ahí
frustrations,
presente
the
en la
anguish
casa,
of not being
no
able to
poder
be
hacer
in
más y
person there
depender de un
at the
cuidador, pero al mismo
house and
tiempo el gran reto
depending
para
on
el
caregivers.
cuidador
But the
de
real
cuidar
challenge is for
a
the
una persona
caregiver to
o de
take
hacerse
care
cargo de alguien que
or take
pues está
charge
perdiendo
of someone
la cognición.
who is losing their
Y
cognitive
de alguna forma
skills.
estas dos cosas se combinaron
And both of
y
these things came
terminé
together, and I
creando
wound up
primero Paz Mental,
creating, first
la
of all,
primera
what we
empresa de
call
atención en casa para
Paz
pacientes con
Mental, which
Alzheimer
is
y
the
deterioros
first
cognitivos.
at-home
Y dentro de
caregiving
esta empresa
platform
nos
for
dimos
people suffering
cuenta,
from
lidiando
cognitive
con los
issues,
diferentes retos
Alzheimer's, and we looked at
de las
several
familias que
challenges
venían a pedir
that
ayuda,
families
de
that
los
were coming to
pacientes, de los
ask for
cuidadores a quienes
support,
tratábamos de
patients,
capacitar,
caregivers that we
pero
were
se
trying
iban
to
cuando ya estaban
train,
capacitados porque
and
tenían que encontrar un trabajo
we
rápido.
and people that needed
Y
to
los
get the
grandes
training or
retos
jobs
operativos
immediately.
que
So
inclusive
some of the
continué
operational
tratando de hacer
challenges,
un gran trabajo con
in
mucho
fact,
esfuerzo
a
con
lot of
capital de
effort
inversionistas.
with investment
Nos
capital
dimos
was
cuenta que el reto era
needed.
mucho más
We
grande
realized
que
that the
la
challenge, though,
capacidad
was much more
humana
daunting in
y que
terms of
la
developing
respuesta tenía que venir de
human
forma integral
resources
y que tendría que estar
capacities.
basada en
It
tecnología.
required a
De
comprehensive
ahí es que
approach
provino
with a lot of
esta visión
technology.
de
And that's
poder
where
crear
the
una plataforma que
perspective came
seguramente
up
vamos a
that
estar
to create
platicando
this
más al respecto.
platform that I know we're
Y
going to be
Ariel, has
getting into more
mencionado una
detail
de las
shortly.
grandes dificultades de
Well,
las
one of the
familias
major
que
challenges
tienen
that you
que brindar
discussed,
servicios de
families that
cuidados de
have to
largo
provide
plazo a
long-term
personas
care
mayores
to the elderly
en su hogar,
in their
que es el
homes.
reto primero de no
First
saber
of all, one of the
cómo organizar
challenges,
ese
not
cuidado,
know exactly how do you organize,
no
how do you
saber
structure this
cuál
care,
es el
to
plan de
not
cuidado que
know
se le debe dar a
what
una
is the
persona mayor. Y
caregiving
segundo,
plan that you
tener
need
que
to provide
coordinar
for the
diferentes
elderly, and
actores,
the need to
por
coordinate
ejemplo,
various
una persona
stakeholders,
cuidadora,
a
los hijos que
caregiver,
viven
the
algunos
children, some of
juntos,
whom
algunos
might live
separados,
there
pero quieren
in
información,
the
quieren
home,
ayudar,
some that are
y otros
outside the home
personal,
that
por ejemplo,
want
del área
information and want to
ambiental.
help, and
Este
also
tema
from the
del plan de
medical
cuidado y de la
community.
coordinación
So
es una
coordinating
gran
all of
dificultad
these
para las
stakeholders is
familias
a
que se
major
enfrentan
challenge
a un
for
reto por
families that
total
are addressing
ignorancia
a
sobre las
challenge where they may
soluciones.
have no
Entonces,
information or knowledge
¿qué
about what
hace tu
would be
emprendimiento
required.
para
So,
ayudar
what
a
does this
resolver
business
estas
venture do
dificultades?
to try to
¿Qué es
address these
Anacare y cómo
challenges? What is
funciona?
Anacare and how does it
Bueno,
operate?
Anacare es una
Well,
plataforma,
Anacare is a
la primera
platform, the
plataforma que
first
nosotros le llamamos que
platform
pone caregiver
that
centric, es
is
decir, que pone
caregiver
al
centric.
cuidador en el centro.
It
Nosotros
places
nos
the
damos
caregiver at
cuenta
the
que si
center
hay un
of the
cuidador
focus.
capacitado y
If there is a
empoderado
well-trained
y que
caregiver,
está bien
empowered
soportado
caregiver who
y se
receives the
siente
proper
con las
support
habilidades
and
y el
feels he has the
respaldo para hacer un buen
skills
trabajo,
and support to
tenemos
do a
una gran
proper
parte del trabajo
job,
resuelto.
then
Entonces, lo que
large
hacemos en
part
la
of our
plataforma, por un
job
lado,
is
es tener
done.
una aplicación
So
para
we
el
have a
cuidador o el
platform with an app
especialista, también puede
for
ser un
specialists,
auxiliar,
caregivers.
un
It could be
enfermero, incluso un
a
rehabilitador, un terapeuta que llega
nurse,
a la casa, en donde
therapist,
esta
physical
persona
therapist,
puede,
where these
primero,
people
tendrá
can,
acceso a una
first of
escuela en
all,
línea que se llama Ana Ilumina,
get
donde
into
puede recibir
online school,
capacitación
Ana
desde
Ilumina,
uno,
where they can
10
receive
minutos,
training
micromódulos,
in
que les
micro
ayudan
modules of 1 to 10
adquirir una
minutes that help
habilidad
them
específica,
develop
por
specific
ejemplo,
skills. For
primeros
example,
auxilios.
providing first aid.
También tiene
Also,
ahí dentro la
with
oportunidad
there's an
de
opportunity here to
certificarte
become
con certificados de
certified
validez oficial en
with
México
official
reconocidos, avalado por
certification
la
in
SEP,
Mexico,
y estamos
endorsed
en
by
los
CEP,
países en los que estamos ya
and
trabajando en
in
otros
countries
países en
where we are
Latinoamérica,
working, other
con las
countries in
autoridades
Latin
locales
America, we're
encontrando
working with
cuál
the
es el
local
certificado
authorities to see
local
exactly
para que
where
esto
this,
se
what is
pueda
the
convertir no nada
certification
más en una
required
plataforma de
locally,
capacitación,
so that
sino de
we can create
certificación
not just a
que permita
platform for
homologar
training, but also
las
certification that will
capacidades
allow us to
de la gente, de los
harmonize
cuidadores
and
y de los
standardize the
diferentes niveles
skills
de cuidado que
and
existen, terapeutas,
certification
rehabilitadores,
of
enfermeros.
caregivers and nurses, assistants.
Además de esto,
In
tenemos,
addition to
gracias a la
that,
inteligencia artificial, la
thanks to
posibilidad hoy en
AI,
día
there's a
de dar,
possibility
creamos
today of
una cosa que se llama
providing
ANA, que es un
what we call
agente que
ANA,
da
an
soporte
agent
emocional,
that provides
soporte
emotional
profesional y
support
ayuda
and
a
provides
el cuidador
assistance
a
to the
encontrar la mejor oferta
caregivers to
para él.
find the
Tenemos también
best
cursos de 20 horas o
combination of
certificaciones de
opportunities.
cientos de
We
horas
have
incluso. Y de esta
courses that
forma
are
en la
from a few
aplicación
hours to hundreds
los
of hours. And in
cuidadores
this
pueden
way, with
tener
the apps,
también elementos que los
caregivers
motivan
can have
como
those
logros,
components that will
consistencia,
encourage them
diplomas.
with logos,
Esta
diplomas.
plataforma se vuelve
This
también un
platform
directorio de cuidadores,
has
una base de datos de
includes a
cuidadores capacitados.
directory, a
Y
database
también en la
of
aplicación un
trained
cuidador puede
caregivers, as
obtener
well as apps. that the caregivers can use to find jobs. So this way, people know who may not be able to attend a university, they know that from their cell phone, and they have public transportation or at home, they can study and they can begin to earn more money. Because one of the major challenges is the caregivers today frequently, despite efforts, does not earn more money. Even if he does a perfect job, doesn't earn more money because the market is extremely informal. So Ana creates this platform for caregivers that allows them, as Marco aptly stated, identifies exactly what needs to be done with medicines, vital signs, immunizations, food, that all that information in a sort of a game plan that helps to communicate to the family to see. It's almost like a employment agency or a directory of caregivers so that we have information as to exactly what is going on and you can update the caregiving in homes. Another challenge is that integration between the social and the health components. It's just beginning now to develop, but it's key because once the caregiver becomes a part into the health system, can help contribute to reduce by 30% healthcare costs. So the platform provides a warning system where when the system detects an early warning sign that something could be alarming, immediately they get in touch with the family or with the service providers so that they can conduct the actions or responses that will perhaps prevent a need to go to the hospital. And this component with the caregivers now adheres to the medicines. We know that 50% of patients, even if they receive treatment, they don't follow it up. So then the caregiver can help with that adherence to the treatments and the retreatment requirements. So we have the app for the caregivers and the apps for the families. Families may be concerned that the caregivers arrive on time, get reports as to what is going on to provide to physicians so that that way we complete the circle of care, medical care. Also provide these reports to insurance companies, governments that can, again, strengthen the care that's being given. The government wants to become more entrenched with these processes. In addition to these two apps, we have an operations system that allows caregiving agencies and providers in home care to maintain better efficiency, better follow-up and control of the processes. So it's through a system of operational medical operations, monitoring, incident registry, all of that automation allows to integrate each one of the stakeholders and provide each stakeholder exactly what they need. Thank you, Ariel. This integration is essential in the area of healthcare, as you mentioned, providing medicines and establishing contact with geriatrics, but also in the caregiving, which is the most social aspect of the care. The fact that information can be conveyed through an app between caregivers, family members, physicians, and back without having to go through other outside channels. It can be centralized to see how the caregiving is evolving. That's a major contribution to the technology solutions we're looking at. Let me get back to Ivan, and let's talk about the importance of improving the quality in the employment of caregivers. Ivan, could you describe just the scope of Cuidados currently? What efforts are being made to work spontaneously with the private sector in order to improve the health provided by caregivers? And also, how has this worked with specific governments, the government of San Juan, to help caregivers and create a market that will allow caregivers to have more job opportunities, better jobs, and better pay? Thank you, Marco, for the question. A very important one. Today, we are located in most of the provinces and major cities in Argentina in order to provide support for family caregivers where people can get in touch in a safe and protected way and autonomously. This is among private individuals we have been developing in each one of the jurisdictions. We have also conducted, and we've had some very successful experiences, such as in the province of San Juan, where we created an ecosystem of caregivers that families can access and contact. And for that, we developed a project where a 2-year project, the most significant phase that included working shoulder to shoulder with the government in a project aimed at mass implementation for the local jurisdiction that included basically a series of steps, including defining each step within the project, the scope of the project, who would be involved in the follow-up activities, as well as convening all of the stakeholders interested. We worked with the communicational components, and then we had a mass enrollment of those caregivers interested. This took place during there was a 4-month period where we had training courses they received until they were certified and enrolled in a public registry of caregivers in the province of San Juan, so that today families can access and get in contact based on their profiles, experiences, skills, and they can be well informed as to who they're contacting. The project that we call the development of the circular economy, because, as I said, it allowed for training of caregivers, structuring and promoting jobs, and that it gets back to the community in the best way possible. So today, we're working autonomously in the province. The province has a registry that remains autonomous because caregivers are improving their experiences and improving their reputations, and families can get in touch with them.
Ivan, allow me to ask you a question, a spontaneous question during the conversation. Does the system allow to provide an evaluation of the work of the caregiver in a way that I call like a caregiving Uber, where families can know who is a good caregiver or which caregiver caused problems in the labor relationship, and maybe have references? Yes, Marco, as every collaborative platform, one of the most important things is the reputation of the caregiver in this case, where it allows the families to evaluate them both at the time of the interview and also when they're already working, and there's a whole specific system for that. Thank you, Ivan. I want to give the floor to Ariel. Ariel, can you explain what the business model is for Anacare? What is its current scope in Latin America and the Caribbean, and how do you think this solution can be scaled? Of course. Well, today we are working hand in hand with organizations that offer caregiving at home, in households, providers of health services to whom we are providing the platform, and we charge them for the use, a license per caregiver, per patient, a month. We work with different organizations that are interested in training and certifying caregivers, or in helping families to monitor or to offer or provide a better value offer. And this lowers costs because it makes them more efficient, and at the same time, it helps them to it helps families to add value as well as caregivers. Today, we work in organizations in 8 countries of Latin America: Mexico, Colombia, Argentina, Venezuela, Ecuador, Bolivia, Costa Rica, with organizations that are trying to formalize and improve caregiving at home. We work also hand in hand with the government of the City of Mexico in a program for senior adults, where before the government would go to visit families or family caregivers and to knock on their doors and detect needs in order to support them. And thanks to the platform, they were able to create an attention model that is much more efficient, and that lowered the time of assistance to 50%, by 50%. So as I said, we work with health organizations, care, governments, insurance companies, and any other service provider that is interested in using technology to improve their value. And little by little, we realize that there are more and more organizations and governments that are interested, from municipal governments, state, federal governments, and other organizations that are helping us grow and to take this to a much higher scale. Thank you, Ariel. Now I'm going to go back to Ivan for one last question that takes us back to the difficulty of households as to knowing what to do when an elderly family member needs care. We don't know if we need a caregiver. We don't know if we need a person, a nurse. We don't know how many hours, what activities should be carried out to maintain our loved ones' skills, cognitive functions the best possible for the longest period of time possible. So what you mentioned, can you explain further this case manager? Yes. Well, we call them the care manager because we believe that in the future, they will be the geriatrics of the future. This is the person that was specialized in care, but also knows, on one hand, how to manage families, and then on the other hand, caregivers, and that has commercial and communication skills, and that would have the tool, or in this case, which is caregiving, that will allow them to be in the middle of the relationship, managing all the needs. We believe now that this could be done not only with one family, but it could be done with 10 or 15 families or 20 and 30 caregivers remotely from their homes. And that in one single place finds, let's imagine, access to potential families that require care, and to access training courses or trained professionals, multiple notebooks and log books to inform the families, among many other things. Let's imagine for a moment now, many specialists in care management providing this service, as if each and every one of them were a specialized node, but specialized on remote care. This is the vision that we have on the caregiver or the geriatric of the future. Okay, and there is no specialization of a healthcare giver at long term, but in Japan, for example, there is something similar, and we've shared several resources in the chat of this webinar, so that those of you or anyone that has gone through this situation can easily understand how life can change by having access to some type of professional that hopefully will be in the public sector, but can also be in the private sector, to guide us in the design of an efficient care plan. Now, before going into a part of the webinar where Diana Rodriguez will tell us what Ecuida is and what the IDB group does with the private sector and how it fits into IDB Cuida or IDB Care. And I will not present as well as she would have, but I'll do my best, and hopefully in the future we will be able to have a webinar on teleassistance and other sectors of the health sector. But also in the chat, we're going to share a link to a publication in 2022 of which Marta was co-author and it has many of these elements. But I want to share with you some of the findings. So, first, teleassistance in Spain is not a small sector. It is a sector where services provided to 1.2 million people with dependence. Second, the fact of having grown or increased this teleassistance to 1.2 million people implies scale economies. We started with 35 euros per individual per month 15 or 20 years ago, and now we are at 15 euros per individual per month. Third, before it was an alternative service. So in other words, you could have teleassistance or other types of services financed by the public sector. Now it is a complementary service of universal right. All the people that are in a situation of dependency have the right to this service aside from others. And this is fundamental because teleassistance, together with domicile care and others, these are the services that allow aging at home and delay institutionalizing that person. It's because it's something that nobody wants, families don't want, and the government doesn't want it because it's the most expensive solution. Fourth, teleassistance has evolved significantly. It's gone from being a reactive model, which means emergency button, a fall, press the button, they'll go and pick you up, towards a proactive assistance where the services know who the people that need more support are, and they call them preventively to know what their situation is without waiting for the actual fall. So far, preventive teleassistance, where with some devices, people can connect to a television as if it were this video conference and carry out prevention activities on cognitive deterioration with these protocols for cognitive stimulation done through teleassistance and included in the costs that I mentioned before. So we hope that you find this information interesting and for you to download the publication and to read it, because this also leads to greater development of teleassistance services in Latin America and the Caribbean. Now, we are ready to give the floor to Diana Rodriguez, who is a special advisor of the chairperson of the IDB, and that will tell us what IDB Care is. And if this is not yet possible, we will move on to Plan B to start with the questions from the audience. And I ask our colleagues, my colleagues, to please let me know when we can give the floor to Diana. So, an initial question from the audience that Ariel or Ivan can answer. I think that it applies to both. We have a question on if some of these services that are being discussed today are in collaboration with the public sector and have public financing, or if we're talking exclusively about services that are privately funded and that the provinces pay for on their own, and the other is the services that the people that participate in care or on a care platform, if the training that they receive, it has some type of public recognition. Go ahead, Ivan, please. I'll go first. Okay.
Primero, respondiendo en la
First,
etapa, por ejemplo, del proyecto San
for
Juan,
example,
durante el momento que
during the
funcionó, hubo
project,
algo de
when it worked, there
financiamiento
was
público
some
para que
public
pudieran acceder,
financing so that they
todas
could access,
las personas obtuvieran todos
so
los
that
cursos de
the
formación
people
y las
could receive
familias
all the training
utilizaran todos los
courses and the
servicios
families
en
could
forma
use all the
gratuita. Una vez
services
terminado el convenio,
free of
ya
cost.
quedó
Once
la
that
relación entre las
agreement
partes. En
ended,
relación a las certificaciones y
then
cuidarlos,
the relationship was
es
established among the
unidad
parties. Now,
formadora
as
del
to
gobierno
care,
de
there's
Buenos
a
Aires que
training
estaban
unit of
cursos avalados
Buenos
por
Aires,
esta
and those
entidad
courses
acá en
are
Argentina.
recognized by this entity here in Argentina.
En nuestro caso, respondiendo al
In
tema
our
de
case,
los
to
avales,
answer
efectivamente, como platicaba antes,
the
trabajamos de la
certifications
mano
or
de
recognitions, we
Conocer en
work hand
México.
in hand with Conocer
De,
in
estamos
Mexico.
iniciando una relación con el SENA
We
en
are
Colombia,
starting a
y cada
relationship
una de las
with
diferentes
Sena in Colombia.
latitudes en las
And
que
each one of the different
aterrizamos,
latitudes where
tratamos de
we
encontrar
land, we
cuál es
try
la
to find
certificación de
what
habilidades
the
con la que podemos
certification
trabajar.
of skills that we can work with is.
Pero siempre tratando,
But
por un lado,
always,
de
on one hand,
dar acceso
trying
a
to
cualquier
give
persona a
access
trabajar o
to
estudiar
any
estos
person to work
microcursos
or
que
study
son
these
convalibles
micro
de ANA, nuestra
courses
propia certificación, y también
that are
certificaciones con
validated by ANA,
habilidades
our own certification, and
en el
also
ámbito
certifications
profesional.
on skills at a professional
En
level.
la parte del financiamiento tenemos
As
diferentes
to
modelos de
financing, we have
financiamiento.
different financing
Evidentemente,
models.
sabemos que
Evidently,
de los entre
we
13
know
y 15
that
millones de cuidadores
from the
de
13 to
adultos
15
mayores
million
que existen en
senior
Latinoamérica, 70%
adult
son
caregivers,
familiares
70%
no
are
remunerados, y después del
unpaid
30%, la
family
mayoría, más del
members, and
95%,
30%, over
son
95%,
cuidadores que están dentro
are
de la
caregivers that are
informalidad, que son
in a
contratados
situation of
directamente por
informality and that
las
are directly
familias.
hired by the
Entonces, en ese
families.
sentido, la
So in that
mayoría de
sense,
los remunerados
the
son las
majority of
propias familias,
those that are paid
pero
are
sí
paid by the
existen cada vez
families
más
themselves.
ofertas
And
de
there are
gobiernos o de
constantly more
instituciones
offers
o de
from
organizaciones
governments,
civiles de lucro que están de
institutions,
alguna
or
forma tratando
nonprofit
de ayudar
organizations that are
tanto a
somehow
pagar por
trying
la
to help
capacitación de los
pay
cuidadores
for
como
training
por
of the
los servicios de
caregivers
cuidado, es decir,
and
por
also
remunerar a quien
for
hace el
the
trabajo.
services,
Vemos, por
their
ejemplo, hoy
caregiving
en día en
services.
Colombia
So we know
existen
today in
algunas
Colombia
IPSs
there are
que
some
son
IPSs that
fondeadas
are
por el gobierno,
funded by the
que
government
están hoy en día ya empezando a dar
and that
servicios de
today are
cuidado.
starting to provide care
Vemos
services.
en Brasil algunos casos
We've
también de
seen
este
some
tipo,
cases in
pero
Brazil as
evidentemente
well of this
aún
type.
en la
But
formación del sistema
evidently,
de
even
cuidado
in the
está en una
training of
etapa
the
temprana,
caregiving system,
donde los
it is
gobiernos
at an early
están
stage where
apenas
the
iniciando
governments
con
are
sus
barely
diferentes
starting
modelos de subvención.
the different
Ahora sí es cierto que, por
the
ejemplo,
different
en México
models.
existe,
Now,
si
it
bien no
is
es un
true that in
subsidio
Mexico,
a un
although
cuidador,
it
hay
is not a
muchos
subsidy
subsidios en
for a
Latinoamérica
caregiver, there are many
directamente a
subsidies in
familias de
Latin
adultos
America that
mayores.
go directly
El
to the
gobierno federal en
families of
México
senior
reparte cerca de
adults.
$300
The
bimestrales
government
a
of
cada
Mexico
adulto mayor,
gives around
y cerca
$300 every
del
quarter
20% de ellos
to senior
requieren un
adults, and
cuidador.
almost
Entonces
20% of
vemos ahí
them
que si
need
bien
a caregiver.
no hay un
So we see
modelo
that although there
directo de
is
subsidio al
not a
cuidado, sí
direct model
existe
to subsidize
dinero que está entrando en forma de
the
subsidio a estas casas
caregiving
que pudiera
activity, there
ser
is money that is
entregado
going
al
to
cuidador.
these households and that can be given to the
Ahora,
caregiver.
otra pregunta que puede ser para
Okay,
los
another
dos.
question that could be for both of
Una
you.
de Fernando
One
Fusterfabla
from
Fernández desde Cataluña.
Fernando
Dice, ¿cómo
from
garantizan la
Catalonia.
integridad
How do you
ética y
guarantee
profesionalidad de los
the ethical
cuidadores
and
en el uso de
professional
su tiempo y el tiempo de las
capacities of
personas
the
en el
caregivers
hogar?
in the use of
Pero
their
también
time
para darle tiempo de
and the
pensar en
services
esto,
they
me acordó
provide
otra
to the
pregunta
person
que
that is being cared
generalizo
for?
que ha venido
And
de
then
más de
another
una
question I
persona.
generalize that has come from
Es
more than one
cómo
person. It's
es el
how
modelo de
or
ingreso
what
de
is
cada uno de
the
estos emprendimientos. Es decir,
income model for
¿qué
each one
margen
of
generan
your
ingresos que
enterprises
permiten
or
escalar?
venture or
Sin hablar
business
de casos
ventures without
específicos,
talking about
porque había
specific
también una pregunta
cases,
sobre
because there
con
was
quién
also a question on
trabajan específicamente, por ejemplo,
who you
IPS,
work with,
pero cómo es el modelo
specifically
de
IPS, but what
generación de
is
ingreso. Quizás pueden
the
empezar de ahí y
income
ir a la parte de la
or the
ética y la
revenue
profesionalidad.
generation model?
Bueno, ¿arranco yo, Ariel, o
Well,
vos?
should I start or
Adelante.
will you? Go ahead.
Bueno, empiezo por la parte de los
Okay, I'll
ingresos.
start with
El modelo,
revenues. The
tenemos dos
model,
modelos,
well, we
uno
have two models,
B2C o Business to Consumer,
B2C
que tiene que ver con
or
que las
business to
familias,
consumer, that
por
has to do with the
matching,
families,
digamos, por
the
encontrar a su
matching
cuidador y por el uso de la
to find their
plataforma para algún
caregiver and the
sistema
use of the
de abono o
platform
de
for
búsqueda,
a search system.
Mientras que también hay otros cursos de formación y demás, algunos
And there are
gratuitos
other
y otros
training
pagos.
courses, some are
En el
free,
mundo
others
del
are paid.
marketplace, donde hay
In
intercambio de
marketplace,
productos y servicios, tenemos acuerdos de revenue
we
respecto a
have
ellos y ahí
revenue
en cada compra
agreements,
existe un formato de participación.
and in
Y
each
en el modelo
one there's
de B2B
a share or
tenemos acuerdos
participation
con
format.
también
And in the
agencias de
B2B, we also
cuidadores
have
geriátricos y
agreements
demás
with
por el uso
agencies,
de la
caregivers,
plataforma
geriatrics
de
for the
cuidados.
use
Este
of
es el
the
modelo hasta ahora.
platform. This is the
Y en
model so far.
relación a garantía, yo no sé si la palabra que uno puede decir es garantía.
As to
Nuestro
guarantee, I
trabajo
don't know
es
if we could say
mejorar el
guarantees.
ecosistema
In our work, it's a
y
matter of
cada vez
improving the
dar
ecosystem,
mayor certidumbre sobre lo que ocurre.
and to
Hoy la
provide more
plataforma
certainty
tiene un
on what is
sistema
happening.
de
Today, the platform
calificación
has
que
a
permite
scoring system that
el
allows
chequeo de los antecedentes y
us
se
to do a
complementa a
background
través de
check.
todos los cursos y
And this is
certificaciones
also
que hayan tenido,
supplemented
donde si
with all the
está hecho
courses,
por un
certifications,
aval público
and
es
if
mayor,
is
permite poner todos
publicly
los certificados de
recognized,
antecedentes y demás, y
and
después
it allows
genera
for the uploading of
reputación
all
por el
the
propio uso de la
background
aplicación. Y como último mecanismo, como comentaba
certificates,
antes,
etc.
está la
And
reputación de
we
los
also have
familiares y
the
demás para cada
reputation
vez
of the family
mejorar
members,
la,
etc., so that we can constantly improve
la calificación de los cuidadores dentro de la
the
plataforma,
rating
digamos. Y
of the
esto,
caregivers in the
si bien no
platform.
es infalible,
And although this is not
con mayor
infallible,
uso mejora
the more it's
sustancialmente
used,
la calidad
the quality
de los cuidados a nuestro criterio.
Gracias,
of
Iván. Rápidamente,
caregiving
Ariel, por
improves
favor, eliges
significantly,
una
in
de
our
las dos
opinion.
preguntas porque
Okay,
tenemos
thank
que
you.
pasar a
Ariel, please choose one
Diana
of the two
después.
questions because we then have to give the floor
Bueno,
to
yo diría
Diana.
que el modelo de ingresos
Well,
por
I would
parte de
say that
reputación,
the
creo que
revenues
Iván,
model in terms of
Iván
reputation,
lo contestó bastante bien.
and
Se
Ivan
parece
answered it
mucho
very well,
en la
and
parte
it
del
is
modelo de
very
ingresos.
similar.
Nuestro modelo es un
In
modelo
the
B2B o
income or
B2C,
revenues,
B2C,
we have a
donde
B2B or
paga una licencia
B2C
por el
or
uso de nuestra
B2B2G.
plataforma. Lo puede hacer
We're paid for a
una
license for the
agencia
use of our platform.
o
This
un
could be done
proveedor de
by an
servicios en casa,
agency
salud
or
en
service
casa.
provider for
Lo
health
puede hacer también un
cares
asegurador, como platicaba antes, y
at
tiene
home. It
derechos
could be
de
done
este
by
valor a sus asegurados. Lo puede hacer una
through
agencia de
insurance. It
compensaciones
could be
como
done
parte de su
through
oferta. Así que
an
básicamente es un modelo de
offset.
licencia.
So it's basically
Perfecto, muchas
a
gracias a
license
los dos
model.
también por respetar los
Okay,
tiempos. Y
thank you
ahora
very
paso la
much
palabra a
to both of
Diana.
you for respecting
Cuéntanos,
time.
Diana, por
Now
favor,
I give the floor to
¿qué
Diana.
es
Diana, please tell
vida
us,
y
what is
cómo
IDB
Bienvenida puede
Care,
trabajar
and
también
how
con el
can
sector
IDB
privado
Care
para
also
mejorar
work with
los
the private
cuidados
sector to
en
improve
nuestra región?
care in our region?
Marco, muchas gracias y perdón, porque te oía decir
Marco,
y estaba
thank you very much, and I
había el
apologize
botoncito para
because I
meter.
heard you say,
Entonces,
but I
disculpa
couldn't
hacerles perder ese tiempo en
use
este momento,
the
pero muchas gracias
I
y
couldn't press the
gracias a los
button
equipos del sector
to
social y de
activate my
IDB Lab
microphone.
por
So,
la
well, thank you
invitación.
very much to the
También
social
quiero
sector, to
agradecer a
IDB
Ariel, a
Lab
Iván,
for the invitation.
a Mar
I
por
also want to
compartir
thank
esas
Ariel,
experiencias.
Ivan, and Marco for
Y
sharing these
Marco, si me permites
experiences.
un segundo
And Marco, if
decir,
you
y es
allow me
reconocer por
for a
qué
moment, and
estar
it's to
teniendo
know
esta discusión, tener
why it's important
soluciones
to have
como
this
las que
discussion and to
Ariel,
have solutions
Iván
such
o
as the
Mar
ones that Ariel,
proponen. O sea, ¿por qué
Ivan,
es tan
Mar
importante
are
tener
proposing.
estas
Why is it so important to have
soluciones?
these
Es
solutions?
una gran noticia
It is
y es
it's great
alentador.
news,
Eh,
and it's encouraging.
es decir, me preocuparía no tener estos
And
ejemplos en un momento tan crucial.
it would
¿Y
worry
por
me
qué
to
digo que
not
es un
have these
momento tan
examples
crucial? Porque lo
during
que
a
Iván y
crucial
Ariel
moment.
están
Because what
mostrando
Ivan
es
and
una
Ariel
solución
are
que
showing
responde a lo que yo creo que
is
es
a
el triple
solution
desafío que
that
enfrenta
responds to
América
what I
Latina y el
consider the
Caribe.
triple
Y
threat that
es
Latin America and the Caribbean are
uno,
facing,
nuestra brecha en
which
y esto es
is
lo mismo, esto se va a conectar a
it's our
cualquier
gap. And this is the
respuesta
same.
con BitQuida.
This will tie into
Y es,
how
primero, ¿cuál
why
es
we
nuestro
respond
primer
with
desafío? Porque
IDB
tenemos
care.
unas
Well,
brechas
one
de
is what is
cobertura
our
y
main
calidad.
challenge
O sea,
because we have gaps
actualmente,
in coverage
incluso
and
en los países con
quality.
mayor
And
cobertura,
even in
menos del
countries with
20%
more
de las personas
coverage,
mayores en situación de
less than
dependencia requieren
20% of
servicios,
individuals
¿no? Y,
that
y
require these
eso lo has
services
estudiado tú
in a
más que
situation
cualquier
of
otro.
dependency
Ningún
actually
país de
receive
la
them.
región alcanza
No
estándares
country in the
de
region
calidad según
reaches
el Instituto de
quality
Métricas y Evaluación de
standards.
la Salud. Entonces, tenemos un tema de cobertura y calidad.
So
Tenemos
we
un
have
segundo
an issue
desafío,
with
que
coverage
es
and
una
quality. We have a
distribución
second
desigual del
challenge, and
trabajo de
it's
cuidado.
an
Y
even
el
distribution
trabajo de cuidado
of caregiving
desproporcionadamente en
work,
las mujeres, entre
which
ellas también mujeres mayores y
lands
mujeres
more
que ellas
in a
mismas
greater
están
proportion in
requiriendo
women
apoyo y están
and women
desarrollando
that
una
also
dependencia cada
need
vez mayor.
support.
Y entonces unas mujeres que
So
están
these are women that are not benefiting from other developments in their lives or well-being. We know that women dedicate 3 times more time to these activities than men do. And then a third is accelerated aging, which is what brings us here, and that we know that in 2050, 1 out of 4 people in Latin America will be over 60 years of age. And that changed our way of thinking completely in terms of consumption patterns, social security, services, and who will be demanding more services. So I think that to have these solutions, as Ariel and Ivan have mentioned, and this desire to innovate and for entrepreneurship in matters of silver economy is absolutely vital, because it also responds to the triple challenge. So that combination of factors and challenges, what does it do? It generates a very upward trend in the demand of care, but it will not be covered just with the public sector. We've traditionally said everything that has to do with caregiving is the state's responsibility, but the reality is that this demand exists, and it will not be enough. Not only the current demand that is included in the first 2 challenges of quality and coverage and excessive dependency on unpaid work, but all of this becomes even worse with the population's aging. So with this triple challenge, we need the private sector and private enterprises, entrepreneurship, because also there is a business case. There are growing opportunities and for business, social innovation. So acknowledging these challenges and these opportunities, that is why IDB Cares was created. And that is our umbrella initiative. And we call it this way because we take advantage of the potential of this economy of caregiving and silver economy, both in the private sector as well as the public sector. So it's an umbrella in the sense that this is an initiative that includes IDB Invest, that finances the private sector, IDB Lab, that supports entrepreneurship, and IDB Public, that is helping to implement and guarantee the investment in cares from the sector. And so, what do we start to see in IDB Care? IDB Cares. First is that we need the public sector. It has a role, a very important role, which is regulation, the establishment of policies. It's the public sector so that there can be entrepreneurships, as we've seen. We sometimes need changes in regulations or new regulations, and that is a fundamental role so that the public sector can create environments of entrepreneurship and promote these ecosystems for entrepreneurship. But, well, I don't want to separate the public sector from its role in entrepreneurships. And also because spokespersons here, Aria and Ivan, they play a central role to encourage the governments to develop regulations that are obstacleizing this development. So that connection between the public sector and the private sector to actually have a regulation that will allow us to have more business ventures is vital. But also in the private sector, per se, it is essential because companies have a central role in society and in their own businesses to reform organizational culture, influence on households and social norms. So there, for example, businesses or enterprises can also contribute to establish flexible labor laws to care for workers. That's fundamental. But Enterprises are specifically key to help to complement in a more agile way the services that are not present today and to help pilot and test these things. So in IDB Cares, it's not just a matter of chance that we're placing national and subnational governments under the same umbrella to define those regulatory frameworks, but also the private sector. Thank you, Diana. Oh, I ran out of time? Yes, you did. Okay, and now I'm gonna pick your brain with a question. And Ariel and Ivan, it's 2035 and the book of history on long-term care giving for Latin America and the Caribbean is being written. Your project has a key title or a key chapter. What is the title of your chapter in this IDB Cares book? 10 seconds each, please. Care finally knows no gender.
Ivan.
Me costó, Marcos, pero es
It was hard, Marco, but revolutionizing the paradigm of care, the history of how people went from going to care centers and care going to their homes. Thank you, Ariel.
Yo diría que
I'd say that with Anna, the caregiver
en la columna vertebral del nuevo sistema de salud.
Became the spinal cord of the new care, of the new health system. Thank you. I want to thank Diana, Ariel, and Ivan for their participation in today's webinar. I want to thank IDB Lab, especially Irene Arias, for her introduction, and also our champion of long-term cares. Thank everyone, and there are many that have joined us today. This has been a very interesting and fundamental discussion on opportunities for entrepreneurship and employment in a sector that is key and fundamental for individuals that depend on others, their families, the people that work with them in a region that is so rapidly aging. In a few days, you'll be able to access the recording of this seminar in Spanish, English, Portuguese on the bank's YouTube website, and also in long-term care, a website that includes all the work that we do in the sector. So see you soon, and thank you very much.
Gracias por la invitación.
Thank you for the invitation.